Hi, and welcome back to looking at the tibia. And what we're going to have a look at now is the lower third of the tibia. And this is where the tibia forms an important joint, the ankle joint, and it forms that with partly with the fibula and partly with the talus. So let's start to pick out some features then of the ankle joint. Of the tibia and the distal end of the tibia. Okay, now generally the distal end of the tibia is referred to as being almost quadrilateral in shape. So you can imagine this large chunk of bone at the distal end of the tibia is seen as quadrilateral in shape. So we're talking about the distal third, of the tibia. And generally it's described as being quadrilateral in shape. Okay. Now, on the medial aspect of the distal third of the tibia, we see a projection of bone, and this is the medial malleolus. Okay. Now I'm going to pick out some features not of the tibia, but of the fibula as well, just so that we have an overall appreciation of what is making up the ankle joint here in a sense. We've got a projection of bone here from the fibula, and this forms the lateral malleolus of the fibula. And if you remember, when you're positioning for an ankle, palpation of the medial and the lateral malleolus becomes an important part of our technique. That when we're doing an AP ankle, we rotate the ankle in slightly so that the medial and the lateral malleolus are equidistant from the digital detector or the tabletop or the CR cassette. Now you can see that the distal end of the tibia sits on top of the talus. Okay. You can see that the talus has an articular surface, and we'll just choose a different colour now to outline that articular surface. So you can see the top of the talus there, or what's referred to as the talar dome, is covered in articular cartilage, and so then will be the inferior aspect of the distal end of the tibia. So under here, on the inferior aspect of the tibia, we are also going to have an articular surface. We can see in a similar articular surface on the distal or on the medial aspect of the lateral malleolus, and that will articulate there with the talar dome. So those are important bony features that make up the distal third of the tibia. Remember also we talked about in the previous video that in here we will have the interosseous membrane, which sits between the fibula and the tibia. So let's have a look now at the posterior aspect of the distal tibia. So let me just clear those pen marks a moment, and that. And we're just going to rotate now. Let me just get rid of the tools a minute. And we're just going to rotate the ankle around now and bring that into view posteriorly. Okay, so we're looking now at the posterior aspect of the distal tibia. So again, let's just pick out some important features that we need to be aware of. Again, we can see the lateral malleolus. And again, that is the downward projection of the distal end of the fibula. Here is our tibia, and we said the lower end of the tibia is almost quadrilateral in shape. Here is our medial malleolus. Part of the tibia itself. We can see some articular cartilage in here, part of the articular surface on the inferior aspect of the tibia. And here we have the articular surface of the talus. Important, from the posterior view, you can see then the talus articulating with the calcaneum. And being aware of the relationship of the distal end of the tibia, the fibula, to the talus, and then to the tarsal bones is going to be really important, but we'll do a separate video on that. So the distal end of the tibia then, we've been able to identify the medial malleolus. We know it's a large quadrilateral area of bone. Inferiorly, it will have an articular surface, which will articulate with the talus. As part of the ankle joint, we know that laterally, the downward projection from the fibula forms the lateral malleolus, and that too articulates here, you can see, with the talus itself, forming part of the distal, forming part of the ankle joint, Now, you will see on the, let me just get rid of some of this pen mark a moment. On the posterior aspect of the tibia, we have quite a prominent bony ridge which runs across the posterior aspect of the tibia. And that gives attachment for the tendon of the tibialis muscle. Okay, so the tendon of the tibialis muscle inserts on that well-defined groove on the posterior aspect of the talus, of the distal tibia. Okay, so what we need to have a look now is generally the sort of shaft of the tibia, and we know that the shaft of the tibia, the anterior aspect of the shaft of the tibia, forms the very prominent shin that we can palpate through the skin. But let me just clear that a moment and return to an anterior view. And let's just have a look generally at the shaft of the tibia. Okay, so we can see, if we remember, that anteriorly we talked about the tibial tuberosity. Okay, and if you remember, we talked about the two condyles of the upper aspect of the tibia sort of merging anteriorly to form this tibial tuberosity. Again, palpable through the skin edge, and then the anterior ridge of the anterior aspect of the tibial shaft, forming the palpable shin that we can feel along the anterior edge of the tibia itself. Now, the shaft narrows from its most proximal aspect, so we can see that the shaft is relatively wide at its superior aspect. It tapers or narrows as the shaft passes down towards the distal third, and then we see that, let me just get that in a moment, we see, let me just clear those pen marks, we see that when we come down again to the distal aspect of the tibia, it starts to broaden out again. So very much the shaft of the tibia is very wide at its proximal aspect. It then becomes narrow as it tapers down towards the distal aspect of the tibia, and then it expands to that quadrilateral chunk of bone at the distal end of the tibia itself. Okay, so what we'll have a look at next is the fibula itself. Thank you.